What's up, guys? Today I want to show you how we can treat some shin splint pain, okay? So people get this when they do a lot of plyometrics or running the concrete. They have some deconditioned lower extremity tissues, or they just do a lot of training and it's just a price to pay when you train a lot. So we got Willie here, and normally in the past I would prescribe someone to use a lacrosse ball at home for this exercise. But today we got a cool tool from Chris Duffin at Kabuki Strength called the Boomstick. So this is the Boomstick. It's 22 pounds in weight. It has a knurling right here that mimics a barbell. Then it has some smooth edges on the edge or on the ends that are really creative for getting different tissue pools depending on where you're trying to treat. So Willie, we already talked about this before we did the video on how I want him to do this. But he's going to use the Boomstick, the edge of it, and he's going to kind of explore his lower extremity tissue. So the first thing he did is he slid off the shin bone or the tibia, and you kind of find out where he has a sticky point that kind of reproduces the same pain that he has from training. And then he's just going to go back and forth between plantar flexion and dorsiflexion, or just pointing his toe away to shorten up the tissue and to bring it towards his knee to lengthen it, okay? So I recommend 8 to 10 passes. With each pass, you're going to realize the tissue is going to release a lot more. And after he gets to the point where he's feeling comfortable there and it's not as intense, then we're going to explore some more tissue. So he's going to go up the chain or down the chain. Obviously, if Willie were to experience any numbness, tingling, or his skin were to turn purple, then we would want him to back off and just don't do it. I like to say if it feels sketchy, then it's sketchy. So we don't want anything turning purple or blue, and we don't want any numbness or tingling. He's going to use the pressure of the Boomstick to mitigate or to manage how much pressure he wants on his tissue. So with more pressure, he'd put more body weight into it, and for less, he would kind of lift off a little bit. But that's why I really like the Boomstick opposed to the lacrosse ball, because the lacrosse ball, you really got to put a lot of force into that tissue to actually get a good release, and the Boomstick already has built-in weight that can do that for you. But if you don't have access to the Boomstick, you can use a lacrosse ball at home. That's what I send patients or clients home with. But I highly recommend checking out the Boomstick. That's at kabukistrength.com. And until next time, guys.